Thank you all for joining us. Today we're going to be hearing from 4 state treasurers about how proposed federal budget cuts threaten both the health and safety of the country's most vulnerable communities and America's economic power and global competitiveness. Our speakers today are Illinois State Treasurer Mike Frerichs, Connecticut Treasurer Erick Russell, New Mexico State Treasurer Laura Montoya, and Massachusetts State Treasurer and Receiver General Deb Goldberg. As we begin, I'll note that we'll begin recording this call to share it afterwards. We have time for questions and answers at the end as well, so feel free to type out questions during the presentation using the Q&A function, and we'll circle back to those at the end. Okay, now let's begin. Treasurer Goldberg, you have the floor.
Thank you very much, and welcome everyone. When I look at what's going on here, there's a real irony. Massachusetts has built one of the strongest economies in the country. We're the national leader in healthcare, education, innovation, and workforce development, all which drive economic growth, creates jobs, and strengthens our country's competitiveness. These budget proposals put forth by President Trump and the Congressional Republicans threaten to undo that success, pulling the rug from under every program that fuels economic opportunity. And this budget, let's make no mistake, is not just an attack on vulnerable families. It's actually a direct hit on the economic foundations that makes Massachusetts and the United States stronger. These are reckless cuts that weaken our workforce, destabilize key industries, and make it harder for businesses to grow and thrive. Massachusetts, and I want to make this very, very clear, we give more to the federal government than we get in return. For every dollar we send to Washington, we receive 72 cents back in federal spending. That means our taxpayers are subsidizing other states. Yet, when it comes time to invest in our people, Washington is now telling us to make do with less. These budget cuts will take even more from states like our states that have proven the strategic investments in healthcare, education, and workforce development pay off, as they do, in higher wages, stronger businesses, and greater economic output. To me, as a business person, none of this makes sense. And if Massachusetts were treated fairly, we would have the resources to build on our success instead of being put in a position to having to fight to hold the line against reckless cuts. And I'm going to take a couple of examples here. Healthcare and our economy. Massachusetts has led the way in expanding coverage, and it's paid off. We consistently rank at the top for healthcare access and outcomes, which translates into a healthier, more productive workforce and increases and creates billions of dollars in economic activity. Yet this budget will drive up the costs for those who rely on the Affordable Care Act marketplace, while slashing Medicaid by $880 billion, putting healthcare at risk for 2 million people in our state. It affects hospitals, nursing homes, disability programs, cuts everywhere, threatening jobs. Let's remember, when people aren't healthy, they can't work. When they don't work, they can't contribute to our economy. This shuts down critical services, and it even leaves workers and families without care. It's simply an economic disaster. Early education. We've been a national model on early education and childcare, and we know there's a direct connection to that and people being able to go to work. Access to childcare allows parents to stay in the workforce. With these low numbers of unemployment, we need as many people as we can to be able to go to work, to be able to retain employees, and set up our kids for success in school and life. It's all interconnected. The budget proposes massive cuts to child care programs, which support over 62,000 Massachusetts children. which allows parents to stay on the job. With over $720 million in federal child care funding at stake, working families could be forced out of the labor force, and businesses would face additional talent shortages, which our economy would automatically suffer the consequences. Food assistance. The Republican budget targets food assistance, putting 1.2 million Massachusetts families, including children, seniors, and working families, at risk. When they can't afford to buy groceries, it's not just a tragedy, it's bad again for our local economy. Grocery stores, farmers, and small businesses depend on consumer spending, and they will feel the impact. Bottom line, we say that this is investing in people. And it's not just the right thing to do, it's smart economic policy. We have one of the highest GDPs per capita in the country because we invest in education, healthcare, and workforce development. This Republican budget would rip apart the economic foundation that we have here in Massachusetts, harming families and businesses alike, all to pay for what? Tax breaks for those who need it the least, the ultra wealthy. This is simply not I'm going to restate this because I feel so. This is not fiscal responsibility. It's self-sabotage. And we will not stand by as decades of progress are threatened. We will fight for a budget that reflects what we believe in, one that strengthens our economy, supports our workforce, and ensures that everyone in Massachusetts has the opportunity to contribute to and benefit from our shared prosperity. We know what works, and this budget is simply the opposite. Thank you.
Thank you, Treasurer Goldberg. Treasurer Frerichs, you have the floor. Treasurer, you're muted.
So I was. Let's try again. This Trump-Musk Republican budget is about two things. It's about tax cuts for billionaires who don't need them, and it's about spreading fear and chaos. So few would argue the government can't be made more efficient at actually delivering results. But the Trump-Musk Republicans are using a machete instead of using a scalpel. One of the federal government's greatest successes has been helping low-income people get health care and coverage. Trump and Musk Republicans want to strip that away and put people back in emergency rooms that already are too crowded to seek basic health care. The Republican budget will hurt small businesses that employ so many people. If people are out sick, they're not at work. They want to be productive, but find themselves unable to contribute because the Trump-Musk Republicans cut basic health care they rely on. They suffer, and our nation's economic prosperity suffers as a result. These Republicans are hell-bent on gutting health care and child care for many of our nation's most vulnerable people, and this is cruelty to fund tax cuts for billionaires. Now, Illinois is not just Chicago. Rural hospitals throughout the state stand to be decimated by the Trump-Musk Republican budget. My office has been instrumental in helping people with disabilities help themselves achieve greater financial independence and dignity by spearheading able accounts that allow savings for medical costs without losing federal benefits. This budget will throw the lives of people with disabilities into chaos by cutting the very health care folks need. It's not America first. It's billionaires first, and the American middle class last. Congress should focus on stability, not chaos and fear. Congress should focus on business growth to ensure prosperity for everyone, not just Trump's and Musk's billionaire cronies. When jobs are available and small businesses are strong, so is our nation. Congress needs to take a balanced approach. Be fiscally responsible, yes, but also foster economic opportunity for everyone, not just handing over billions of dollars in tax cuts to Donald Trump, Elon Musk, and their billionaire cronies.
Thank you, Treasurer. Next up, we have New Mexico State Treasurer Laura Montoya. Treasurer Montoya.
Good afternoon. Thank you, Dave, and thank you to my colleagues. I'm grateful that all of them are on here bringing concern and issue to the forefront about what this administration and what these budget cuts are currently doing to some of our most vulnerable populations. Speaker Mike Johnson and the House GOP's recently passed budget, which includes cutting Medicaid by $880 billion over the next 10 years, will have disastrous consequences for the vulnerable New Mexicans and Americans across this country who rely on Medicaid and critical medical coverage. New Mexico is the nation's largest recipient state for Medicaid assistance, with nearly 33% of our state's population relying on Medicaid or CHIP, better known as the Children's Health Insurance Program. Medicaid and Medicare are the largest payers of healthcare in the nation. When the federal government slashes funding, hospitals, doctors' offices, and clinics that depend on these funds will be forced to either raise premiums and co-pays for patients or shut down altogether. 80% of U.S. counties, including those in New Mexico, are considered healthcare deserts, where healthcare is difficult to access or entirely inaccessible. That's a ton of our rural communities in our nation. These cuts will exacerbate healthcare and inaccessibility when currently 1 in 10 Americans already face difficulty finding care. Almost 80% of our babies born in New Mexico are born into Medicaid. Data shows that the first 3 years of a child's life are the most consequential for healthy growth and development. These cuts mean doctors and healthcare facilities will not have the capacity or funding they need to provide access to critical milestone appointments. Long-term, cutting Medicaid will mean steeper birth rate decline when New Mexico and the country are already facing significant issues resulting from declining fertility rates, such as an aging population, a smaller and weaker workforce, which results in lower tax returns. Many in our disability community, including our veterans, rely on Medicaid coverage for essential health services. To put it into perspective, New Mexico is ranked 13th in the nation for the highest rate of veterans per capita, with over 120,000 veterans calling our state home. Any cuts to Medicaid will be detrimental to people with disabilities, especially those who have sacrificed their well-being to valiantly serve our country. In addition, small businesses who provide health care for their employees will also be forced to either pay more for their employee benefits if they can continue providing health insurance at all. This leads to pressure on these businesses to divert resources away from growth and innovation to shoulder the higher premiums, limiting their ability to hire more workers or expand their business or pass on that cost to the consumer. It is exhausting to hear Congress talk out of both sides of their mouth. Do not tell me that you love and support our children, our parents, our families, our veterans, and small businesses, especially when you're trying to get elected to serve them, while actively pushing for an almost $1 trillion cut to Medicaid. This is reckless policy that will in no doubt harm communities, our state, and our entire nation. Congress cannot be that oblivious to not know the devastating impact this policy has on the very people that elected them to protect and defend them. This budget cut reveals a deep-seated disregard for humanity. When I talk about Medicaid or the detrimental effects of Speaker Johnson's plan to cut critical federal benefits, I'm not talking about a government program. I'm talking about the choice between life and death, forced upon hardworking people that cannot afford the right to health care under our current system, let alone a system that will be inaccessible and fiscally unsustainable by design. Humans should never be forced to choose between a roof over their head, food to sustain themselves, or life-saving medication to live. Just recently, a 22-year-old man from Wisconsin, Cole Schmidtnick, was forced to make the painful, difficult choice between rent and an inhaler for his asthma when the cost of the inhaler went up from $66 to $539. Cole's choice tragically cost him his life, paying the ultimate price when he chose not to be homeless instead of purchasing his life-saving medication, a choice no one should ever have to make. Under the Medicaid cut proposal, Cole's story is just the beginning of a heartbreaking new reality for tens of millions of Americans. Let's get even closer to New Mexico. In 2022, Polling showed that 44% of New Mexicans did not fill their prescriptions or skipped taking medication due to cost concerns. That means almost half of New Mexicans made the difficult choice of foregoing their own health for the sake of paying bills to survive and make ends meet. If you think this only affects people on Medicaid, you are highly mistaken. Every one of us will have to make these difficult sacrifices. Every single patient and provider will pay the price for such careless, baseless Medicaid cuts. Similar to what we learned during COVID, when some of us are not healthy, none of us are healthy. The effect of bad policy, despite who's being targeted, does not discriminate. Even the wealthiest people still rely on the labor of working class to keep up their lifestyles. We still need the middle class and the lower class who take care of our children, they construct our homes, they farm, they make our food, they build our businesses, and more to keep the economy thriving. Don't be confused, we all know how this country got built. Our economy will not be spared, as the detriments of gutting Medicaid extend far beyond healthcare, leading to economic insecurity and turmoil. When people do not know if they can afford basic medical coverage or necessities, they hold back on spending, stifling economic growth and deepening financial uncertainty, stress, and fear. We have the largest economy in the world, but our healthcare system ranks 38th when the healthcare is considered across the globe to be the fundamental human right. Apparently, this right only applies to certain people of higher stations, including our own elected officials in Congress. The irony of making cuts to Medicaid is that members of Congress enjoy some of the best healthcare in the nation, while most Americans struggle to afford the most basic service. The very lawmakers elected to serve America's best interests are the same very ones who are granting themselves access to top-tier, comprehensive healthcare coverage most Americans can only ever dream of. The lawmakers have access to premium healthcare. Some are so fixated on attacking our most vulnerable that they undermine the core values that they and our government were intended to uphold: service to the public. Representative democracy is intended to reflect who we are and what we value. When lawmakers fail to represent us, a dangerous precedent is setting that makes life significantly worse for most Americans. Honest, hardworking, everyday Americans are stressed. So people power is strong, and together we can ensure that American policies are in America's best interest. So my call to action to all of you today is that we call on our lawmakers to vote against this budget and protect America and our economy.
Thank you, Treasurer Montoya. Now for our last speaker, Treasurer Russell from Connecticut. Treasurer.
Thank you, Dave. As was mentioned, I am Erick Russell. I'm the state treasurer in Connecticut. It is great to be here with my colleagues today. As we encounter much of what we've seen, it's hard to believe in many ways that we are only a month into this new administration. And what has been certain for the last month, the only thing that's really been certain has been chaos and uncertainty, frankly. And that what we're seeing is ultimately devastating to people all across this country. It's harmful to our states and our local governments. It's harmful to our economies, and most importantly, to working people and working families in our states. We've been fortunate here in Connecticut in many ways. We have a growing economy. We've balanced fiscal responsibility and balanced budgets and record surpluses in paying down long-term debt, with making sure that we're also investing directly in people in our states, particularly people who are most vulnerable and most at risk in our state. And what we are seeing right now is the continuation of this chaos that we've seen over the last month, threatening the progress that we are making as states. This budget proposal that has been passed by the House, that has been essentially endorsed by the president, would be devastating to so many communities here in Connecticut and across the country, particularly when you think about the impact of cuts to Medicaid. There are nearly 1 million people in Connecticut that are covered by Medicaid, including hundreds of thousands of children. There are numerous elderly folks that are in nursing homes. Half of the children, almost half of the children born in Connecticut on an annual basis their birth is covered by Husky, our state's Medicaid program. The reality is that for people, again, who are struggling the most, who have the most challenges in our states, are going to be the most impacted. And we're seeing this with respect to Medicaid, but also threats to cuts around healthcare more broadly and childcare and food assistance programs, cuts to nonprofit services that we are already seeing in our states. And I also think it is very important to keep in mind as we look at this proposal, under the guise of fiscal responsibility, that in the best case scenario, in the rosiest picture of cuts under this proposed budget, it is still proposed that we will be adding trillions of dollars to the national deficit under this plan over the next decade. That's not fiscal responsibility, and the way it's being done certainly isn't beneficial to Americans. We've seen this a complete walk away from what the administration committed to and promised Americans coming in, is that the main focus was going to be lowering costs for families in our country and helping to bring down inflation. And we don't know exactly what's to come, but I think what has been consistent is that policies being proposed and discussed are doing the exact opposite. In many ways, it's the trifecta of inflation. You have tariff proposals that are sure to drive up cost for things like groceries and energy for families all across our country. You have policies associated with mass deportation of both documented and undocumented immigrants, which will be devastating to our workforce and will certainly drive up costs for businesses in our country. And as was just mentioned, what will be a ballooning deficit. And to be very clear, we are all supportive of a concept of government efficiency. I don't think anyone on this call would object to the idea that we can make government work better for people in this country. But that's not what this is about. It's the exact opposite. This is an effort by someone who has not been elected or nominated or confirmed by Congress to dismantle government itself in many ways. And all of this is being done at the cost of working families with the ultimate goal of cutting trillions of dollars in taxes for billionaires and large corporations across this country. It's wrong. It's wrong. And it is our time for everyone to step up and make sure that we are speaking out and pushing back against this budget and any budgets that are proposed to do similar things that will ultimately be devastating to our states and our local governments and our communities more broadly. And so similarly, I call everyone to action. This is the time for everyone to step up and speak out against what we're seeing, to speak out against this budget that is sure to harm Connecticut residents and Americans all across this country, and to make sure that a budget that is ultimately passed meets the balance of fiscal responsibility, growing our economies, and protecting Americans all across this country. Thank you.
Thank you, Treasurer Russell. Now we're going to take some questions. So if you have any questions, please enter them into the panel on the Zoom screen for questions. We'll start with this first question while you all are putting questions in. State budgets rely on a mix of federal and state funding. With these proposed federal cuts, how will the state compensate for potential shortfalls in essential services? Will it require higher state taxes, budget reallocations, or program eliminations? Would anybody like to start?
Dave, I will say that we're in legislative session right now, so a lot of folks our legislators are looking at how these are negatively impacting us. On the FEMA side, we have a lot of fires that occurred, particularly in northern New Mexico and in Ruidoso, that there's a bill currently to help with 0% loans until everything can get situated on the federal side. These are fires that have devastated a lot of farmers and ranchers in rural communities. The governor has already stated that more than likely we're going to have a special session only to particularly focus on everything that Congress is screwing up at the national level. And of course, any kind of funding that we need to be able to provide is going to have to come out of the general fund budget for the state level. We have a lot of military bases. We have our Los Alamos labs, our Sandia labs. A lot of people got laid off. Our U.S. attorney got fired as well, or told to leave. So the governor has told everyone that has had this type of devastating effect of their job to try to get unemployment as soon as possible, and that we're more than welcoming in helping our communities.
Great, thanks. Does anybody else want to take this one, or do we move to the next?
Well, I think what I could say is that, and our governor just commented on this yesterday. Healthcare is an enormous industry and employer in Massachusetts, as is our research universities. We don't have a lot of farmland. We don't have oil wells. We don't have a lot of other industries. And any cuts to Mass Health or NIH funding or the like are going to have a truly negative impact, not only on Massachusetts' economy, but the world. In many ways, we are a worldwide center for a lot of this that goes on. We don't know what the total impact will be, but we know that we're just heading into our budget season. And there will be a lot of conversations about how we will be able to continue funding what we typically fund and what we will do to be able to support our local industries, which are hospitals, research universities, and the like. We even expect biotech and high tech to be impacted by these things. So the good news for us is that we are very well managed fiscally, and we have a very strong rainy day fund. But as the steward of the rainy day fund, I would like to not see us have to dip into that kind of thing. We need Congress to understand that what they are looking at is undermining our economy. They have to take a greater business-like approach to this. It is their responsibility.
Thank you, Treasurer Goldberg. Let me move on to the next question. Is there anybody to answer? What is your message to Republican senators as the House GOP's proposal goes through Congress?
Well, I hope that they show some backbone. There are multiple branches of government. I think the Trump administration would like there to be one branch, the executive branch, with legislative bodies that are completely compliant to them. The people hopefully run for office because they believe in this country, they believe in our Constitution, they believe in fiscal sanity, and they care about the people in this country. And so hopefully they will stand up and they will negotiate for a budget that doesn't push as many costs onto average working people so that the billionaires can have tax cuts. Hopefully they will stand up for our allies. Hopefully they will stand up for working people, and that's what I hope they should do.
Anybody else want to add to that?
I think it's, for me, more important about, we the people are the power, and we need to call them and make them be held accountable. I mean, I don't know who voted for these people, but whoever voted for them should be calling them right now and telling them to stop doing what they're doing. I think for me, I'm blown away how much people state they support veterans and children, and they want you to have these children and they want you to birth them, but they don't want to help support them in that process. Like, everyone has, on both sides of the aisle, has said 0 to 3 years is the most critical time. But if you cut Medicaid, and 80% of all babies here, and even in Connecticut, where we have a different economy overall, is still affected by that much. That should tell you something. I mean, I don't know who's looking at the numbers, but you can't tell me you're fiscally responsible, you love our veterans, you love our children, and then you basically bend each one of those groups of people over. So I hope people will come together and fight and let them be held accountable. And when they're not held accountable, I hope they figure that out and vote.
Great, thanks, Treasurer Montoya. If anybody would like to ask a question, we can also unmute them. So is there anybody who'd like to ask a question? Okay, here, we'll go on to one more and then come back to that. So next question is, many working families rely on federally supported childcare programs to remain in the workforce. If these cuts go through, what ripple effects do you expect at the state level in terms of employment, tax revenue, and small business stability?
I'm happy to start here. And I think that this question, thank you for it. It's because it's really important. And I think the best example of this point was actually during COVID. I think it's when everyone was really tested around this issue. We for so long have looked at childcare as this luxury or this option for people. And it's already an industry where people are underpaid. It's mostly women working in this space, women of color. And what we know is that this is an economic issue, that we cannot have people out in our economy contributing, participating, if they don't have safe and reliable places for their children to be taken care of. And so it's why here in Connecticut, we have made this such a priority, and we continue to invest more and more into childcare because we know how critical it is to our economy. For you think about, and similar to Massachusetts in many ways, have a very strong healthcare industry. And again, during COVID, nurses and folks working in hospitals needed to have somewhere to bring their children from. And so if we are not going to make these investments big picture, it certainly is going to impact our states directly from an employment perspective, from a revenue perspective, and just for the ability for everyone to participate in our economies in a really meaningful way.
I'd like to just add to that quickly. One of the things we've heard the president complain about is the educational attainment of our kids as they evolve into our workforce. When all studies show, and this is what our emphasis is here in Massachusetts, is, and when I spoke earlier, I mentioned the impact it will have on childcare and our economy, is our childcare is early education also. And we know that many of the countries that we're competing with start early education. And that's one of the questions in comparing our educational attainment. Cutting into that not only affects our workforce's ability to work, which then impacts our businesses and our economy in a very rapid fashion, they are also consumers. And with less consumer dollars, they spend less. And our kids will not be as well educated. And if that's an issue for this president and this Congress, then pulling investment in childcare and early education is totally illogical from my perspective and most people in our state of Massachusetts. And I would venture to say everyone on this call.
Great, thank you, Treasurer Goldberg. We have a question from Dave Mager at WTIC News. Question is, most of these cuts are illegal. They're from a rogue administration acting outside of its constitutional authority to eliminate legal, congressionally approved spending. What's being done to stop them?
Yeah, I appreciate that question. You're correct. A lot of this is illegal. For those of us who believe in the Constitution, those who believe that there are different branches of government, the first step is for the courts to step in and order changes. But I think the Trump administration has made it clear that they don't necessarily want to respect the courts unless the courts agree with them. And we're going to see, I think there was some statement about, do the courts have an army behind them? I think that there are people who are involved in our federal government, involved in our military, who, when there are blatantly illegal actions, need to stand up. But I think for right now, our attorneys generals, our courts are playing the role that they were, our founding fathers set up for them.
Yeah, and similarly, I would just say this is why we are working closely with our attorneys generals, with our governors, right, to make sure that we are prepared for these responses. As again, with this being illegal, we're prepared with things like the Impoundment Act and to calculate damages that are a result of these unlawful withholdings. But I think as Treasurer Frerichs mentioned, this is also why it is so important for particularly Republican senators and members of Congress to step up. We right now have a president that believes that he has the ability to act as he wants, without checks, without balances. And frankly, we haven't seen anyone step up to be that check in any way, which is the really troubling part here. And so we're going to continue to do the work that we have control over on our end, but it's also really critical that everyone steps up to do their job right now.
Thank you, Treasurer. We'll do one more question and then close this out. So last question is, given the House budget's deep cuts to Medicaid, how do you anticipate this will impact state finances if passed through Congress, particularly with increased uncompensated costs for hospitals and strain on emergency services?
I'm
Anybody?
happy to start and to kick it off, but this obviously would be huge for all of our states. I think there's the one piece, as Treasurer Goldberg mentioned, that's just the economic piece in our states. Connecticut is very similar in healthcare, the healthcare industry being a huge driver of employment and economic growth in our state, which will certainly be impacted. From a budgetary perspective, again, we are in strong fiscal condition, but we get over $14 billion a year from the federal government. We are not in a position to fully match those funds being withheld or pulled back. And when you think about particularly around Medicaid, where we are currently, reimbursed at an 87% rate, if that's dropped back down to 50% as it was done prior to the Affordable Care Act, I mean, we'd be adding nearly $1 billion of cost to our budget for the state. And so this is really critical for us to, again, have this funding in place so that the most vulnerable in our communities are able to get the care that they need.
And I'd like to add that pushing people into, again, utilizing our emergency rooms as their primary care physicians is about the most inefficient way that you can address healthcare needs. This was the very argument in favor of the Affordable Care Act, is that we would develop a more efficient system, ensure coverage, proactive care instead of critical care, and the uncompensated pools in the state get reimbursed by the taxpayers. But it's at a higher cost per taxpayer than the way in which we've switched over since our Massachusetts healthcare law in 2006, followed by the Affordable Care Act. And again, as a business person, this is such an illogical approach to how you're going to deliver care. It's really shocking when we have a system that may have some flaws, but works in a way of ensuring that people are covered and are keeping themselves healthy and being part of our workforce.
Have a couple of things. More people are going to use 911 services, right, for emergency aspects, and the indigent fund, which the state has to fund. So all of that is inefficient as well. But I think for the press and for those on the call, I think it's really important for us to ask why. Why get people so riled up in fear of being able to have items that are just supposed to be part of humanity? And when we have a government, we've all been told economically, if you don't have a middle class and a lower class, then your economy falls. All of these tax cuts that the rich are getting, all of the stress and anxiety for the very vulnerable people just to have medical coverage, what's the end game? I mean, we talked last week about the Mexican tariffs and how that impacted different parts of the Southwest. I know some of my colleagues talked about how the Canadian tariffs on Canada had impacted them. Full circle, why would somebody who loves our country, who loves our people, and who asked them that they wanted to serve them, why would they negatively impact them in all these different directions to where people are stressed? And when you look at it from an economic standpoint, What are you doing to our economy outside of the trillions of dollars in deficit? There's this aspect of supply and demand, and people are afraid to spend because inflation is high. They don't know if they're gonna have their job. They don't know if they're gonna be able to pay for their next month's rent or their next month's mortgage. So I just want the press to really hold people accountable to the why, and Americans to start holding their legislators accountable to why aren't you serving the people that put you in office.
Thank you, Treasurer. With that, we're gonna close up. Thank you, everybody, for joining us. As I mentioned at the beginning of the call, we're going to share out the recording for this call. And thank you again for joining us, and we'll be in touch.